Hi, everyone. This is Dr. J here, and today we will be talking about exercise in asthma. But before we start, I just want to start off with a disclaimer that if you have any questions about your medical health, please consult your primary care physician. This information is for educational purposes only. All right, so let's start. Let's start by defining what is asthma. So asthma is an inflammatory disorder that is characterized by airway hyperresponsiveness. And the airways of the lung can become hyperresponsive to specific triggers. That can be cold, that could be certain allergens or pollutants in the air. Now, I wanted to distinguish asthma versus exercise-induced asthma or exercise-induced bronchoconstriction. Just so that I can define the word bronchoconstriction just means that there's a narrowing of the airways of your lungs. The way that you know you have exercise-induced asthma is that you have symptoms at rest and during exercise. So what would those symptoms be? There would be wheezing, shortness of breath, coughing, chest tightness. And these symptoms are usually in the early morning or at night. The way that you know that you have exercise-induced bronchoconstriction without asthma is that you only have those symptoms during exercise. So that is the way that you know how you have exercise-induced bronchoconstriction without asthma. Now, can you still exercise with asthma or exercise-induced bronchoconstriction? Yes, you can. Now, especially if you have asthma, since people with asthma may have symptoms at rest and during exercise, you have to make sure that your symptoms are well controlled. And that is typically done by knowing what your triggers are and avoiding them, and also making sure that you're on the appropriate therapy that controls your asthma symptoms. So you may have to see your primary care physician or your pulmonologist to make sure you're on the right inhaler therapy. If you have symptoms during exercise, then you want to prevent those symptoms, right? Because who wants to be feeling short of breath and wheezing and chest tightness while they're exercising? It's already hard enough as is. So the way to prevent those symptoms is to make sure that you have albuterol, which is a short-acting, I'm going to forego the medical terms, but it is an inhaler that works quickly. So when I say that it works quickly, you can achieve relief in about 5 minutes, less than 5 minutes. It takes less than 5 minutes to work, and the relief can last up to 2 to 6 hours. However, if you're still having symptoms during exercise, it's important to have that inhaler on hand so you can prevent any of those symptoms. Okay, so that was my brief talk on asthma and exercise-induced bronchoconstriction, and I hope you found this helpful. If you have any questions or you want to know more information about anything to do with exercise, fitness, mindset, I love mindset, I love talking about mindset, then let me know in the comments, okay? Thanks, bye.